Have you received medical services and then got a bill with all kinds of unanticipated charges? Well, there's some rulemaking that will help. This information is also crucial for medical providers and facilities because there are requirements for you. And if you stay until the end of the video, I'll let you know some other proposed rules that may also help. Hey there, and welcome. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've transformed hundreds of students to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. Early in July, the Department of Health and Human Services, the Department of Labor, the Department of the Treasury, and the Office of Personnel Management issued an interim final rule with comment period, also called an IFC, named Requirements Related to Surprise Billing, Part 1. Part 1 indicates there will be additional parts. This rule details the laws for several groups, including healthcare providers and facilities. This rule is related to Title I, the No Surprises Act of the Consolidated Appropriations Act 2021. This rule establishes new protections from surprise billing and excessive cost sharing for consumers receiving healthcare items and services. So let's make sure we are all on the same page and get an understanding of the background of this rule. Most group health plans and health insurance issuers that offer group or individual health insurance coverage have a network of providers and healthcare facilities, which are called in-network providers. These providers agree to accept a specific payment amount for their services. Providers and facilities that are not part of a plan's network are called out-of-network providers, and they usually charge higher amounts than the contracted rates the plans pay to in-network providers. When a person with health insurance coverage gets care from an out-of-network provider, their health plan usually does not cover the entire out-of-network cost, leaving the person with higher costs than if they had been seen by an in-network provider. In many cases, the out-of-network provider may bill the individual for the difference between the bill charge and the amount paid by their plan or insurance, unless prohibited by state law. This is known as balance billing. A balance bill may come as a surprise for many people. A surprise medical bill is an unexpected bill from a healthcare provider or facility. This can happen when a person with health insurance unknowingly gets medical care from a provider or facility outside their health plan's network. Surprise billing happens in both emergency and non-emergency care. Let's look at an emergency situation. In an emergency, an individual usually goes or is taken to the nearest emergency department. Even if they go to an in-network hospital for emergency care, they might get care from an out-of-network provider at that facility. Consequently, for non-emergency care, an individual might choose an in-network facility or an in-network provider, but not know that a provider involved in their care, for example, an anesthesiologist or radiologist, is an out-of-network provider. In both emergency and non-emergency circumstances, the person might not be able to choose the provider or ensure that all of their care is from a participating provider. In addition to getting a bill for their cost-sharing amount, like co-payments, co-insurances, and any applicable deductibles, of course, this tends to be higher for those out-of-network services, the individual might also get a balance bill from the out-of-network provider or facility. This is especially common in the context of air ambulance services, for which individuals generally do not have the ability to choose an air ambulance provider and have little or no control over whether the provider is in network with their plan or coverage. When individuals do not have an opportunity to select in-network providers, their healthcare costs go up overall. Surprise billing is often used as leverage by providers to get higher in-network payments, which result in higher premiums, higher cost sharing for consumers, and increased healthcare spending overall. Surprise bills can be high and out-of-network cost sharing, and surprise bills usually do not count towards a person's deductible and maximum out-of-pocket limit. Individuals with surprise bill may have to spend more out of pocket because they have to pay their out-of-pocket network cost sharing and surprise billing amounts, regardless of whether they have met their deductible and maximum out-of-pocket limits. This interim final rule with comment period, or IFC, protects individuals from surprise medical bills for emergency services, air ambulance services provided by out-of-network providers, and non-emergency services provided by out-of-network providers at in-network facilities in certain circumstances. If a plan or coverage provides or covers any benefits for emergency services, then this IFC requires emergency services to be covered. 1, without any prior authorization or approval beforehand. 2, regardless of whether the provider is an in-network provider or an in-network emergency facility. And 3, regardless of any other term or condition of the plan or coverage other than the exclusion or coordination of benefits or a permitted affiliation or waiting period. Emergency services include certain services in an emergency department of a hospital or an independent freestanding emergency department, as well as post-stabilization services in certain instances. This IFC also limits cost sharing for out-of-network services subject to these protections to no higher than in-network levels. Requires such cost sharing to count toward any in-network deductibles and out-of-pocket maximums, and prohibits balance billing. These limitations apply to out-of-network emergency services, air ambulance services furnished by out-of-network providers, and certain non-emergency services furnished by out-of-network providers at certain in-network facilities, including hospitals and ambulatory surgical centers. The IFC also states that providers and facilities must provide patients with a consumer notice explaining that patient consent is required to receive care on an out-of-network basis before that provider can bill at the higher out-of-network rate. The notice must contain a good faith estimate of the costs. Providers and facilities are expressly prohibited from seeking consent from individuals in certain circumstances. Also, facilities and providers are required to retain written notice and consent documents for at least 7 years. So, as I mentioned, this is just part 1. Be on the lookout for more rules. Also, this rule is effective January 1, 2022. So you have learned that an interim final rule with comments that is based on the No Surprises Act of 2021. You have also learned the details of the IFC for healthcare providers, facilities, and the benefits for patients. Questions of the day. Were you familiar with the no surprise billing rules? What are your thoughts on this rule? Let me know in the comments below. I mentioned some additional rulemaking, and as promised, there is additional rulemaking coming on the independent dispute resolution process, additional transparency measures, and price comparison tools. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. If you are interested in these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. If you liked the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know that you were here by providing a comment or asking a question. You can also give me a little love by sharing this video on your social media platforms. Tag me in your video share at PRN Coding EDU. Let's stay connected and connect others. If you want to learn more on the wonderful world of health information, medical coding, and/or compliance, watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.